Hi, this is Stephen, and in this series of videos we will discuss diastology, or how the heart fills with blood flow. Systology, that we've talked about with the ejection fraction before, is how the heart pumps out, but this is how the heart fills. And the first parameter that we'll need to discuss is tissue Doppler. And so let's look at our at our apical four-chamber view. And we've got our left atrium that empties blood into the left ventricle via the mitral valve. Over here we've got the right ventricle, right atrium. Now, you may recall we've actually touched on tissue Doppler before, specifically if we come over here on the right ventricle and we measure with tissue Doppler. Remember, tissue Doppler is similar to regular Doppler looking at blood flow, except it's looking at the tissue movement and consequently much lower velocities. So this would be centimeters per second, and this would be seconds. You'll see a S prime wave, and then you'll see a E prime wave, an A prime wave, S prime, E prime, A prime. And specifically, we said that your S prime should be greater than or equal to 10 centimeters per second if you have normal right ventricular systolic function. So that's all review. Can we use that same concept over on the left ventricle to quantify how well the ventricle is filling with blood? And the answer is yes. So let's come right here and move our tissue Doppler according to the tissue right at the base of the left ventricle at the septum. And we'll get a graph that shows in systole that the wall moves up like that. That's our S prime. And then in diastole, E prime, and then A prime. Systole, diastole, systole, and like that. And so again, our units are centimeter per second, and here our units are second, S prime, E prime, and A prime. We use prime whenever we're talking about tissue Doppler, so it's easy to understand. And I'm just going to remind you here that this is during systole, and these are during diastole. Why are there two waveforms during diastole? Well, if you actually look at the mitral valve, you'll see it kind of flicker as it opens. And if you look at the blood flow through the mitral valve, you'll see that there's early flow as soon as the mitral valve opens. And then you'll see that there is an additional burst of flow after a pause from the atrial kick. And the E prime and A prime show how the left ventricle is responding, how it's interacting with that flow. And so the higher the E prime, the higher the A prime, the more the tissue is relaxing, the better the diastolic function. And so let's measure the same right over here. We take our tissue Doppler and we put it over right at the base of the left ventricle, but this time away from the septum at the lateral aspect. And again, we'll get a graph, centimeters per second. Second, we'll see our S prime in systole, and then in diastole, we'll see our E prime and A prime, S prime, E prime, A prime, S prime, and so on and so forth. And the parameter that we're interested again here is E prime. And so I'm going to circle both of these. So what we really care about is E prime, both from the septal aspect and from the lateral aspect. Now, what are normal? Well, or what is abnormal is another way to look at that. So the septum, it should be 6 plus. It should be moving at least 6 centimeters per second. Otherwise, we say that the left ventricular wall is not moving enough. There's some kind of diastolic dysfunction. We'll talk about all the different grades in a future video, but there's something wrong. And similarly, over here, usually the lateral wall moves just a little more. So that should be 7 plus. Regardless of age, if it's not at least 7, that makes us concerned that there is some type of filling problem because the left ventricle walls are not moving enough in diastole, in that early phase of diastole. And so tissue Doppler, looking both at the septal and at the lateral wall movement, is a very useful tool in diastology.